Lecture series. I hope you liked the yesterday's session, and today is the 8th day of our lecture series. The topic of today's session is scientific writing and publication skills that contain familiarization with publication guidelines, journal specific and CONSORT guidelines, different types of referencing and bibliography, thesis, dissertation, and contents and structure. Its contents and structure. Research article structuring. It contains introduction, methods, result, and discussion. That is IMRAD, which is going to be presented by Dr. Srihari Seshagiri sir. He has completed his BMS MD from Alvas Ayurveda Medical College, PhD from IPGTR University, Gujarat. At present, he is a Vice Dean and Associate Professor in the Department of Kumar Bhitya in Mahatma Gandhi Ayurveda College, Hospital and Research Center, Salod, Hirapur, Wardha. He is enlisted as mentor in SILICE project funded by European Union and ENPRENDIA project funded by European Union. He is editor-chief journal in Journal of Indian System of Medicine. He is a member of Asia Pacific Association of Medical Journal Editors (WHO). He is the secretary in Quality Control Committee (NABH), MHACH, and RC. He is a member and research cell representative, PhD Cell Faculty of Ayurveda, DMIMS, Delhi University. He has teaching experience of 9 years, PG guide from the last 2 years, PG guide from the last 5 years. He has 9 years experience in research and has completed 4 research work. He is invited as guest speaker and enlisted as chairperson in various national and international webinar and conferences. He has presented various research papers and published more than 30 articles in various international and national index journals. Now I would like to welcome Dr. Srihari Seshagiri sir to present today's session on the topic of scientific writing and public skills and research article structuring and its role in research field for the students. Welcome, sir.
Thank you, Dr. Leena. First of all, I would like to apologize for the delay because for some important university work, I had to attend that one. And sorry for that, this 20 minutes delay. And I would like to first give my sense of appreciation that you've given me a chance to speak regarding this topic. Actually, the topic is, as Dr. Leena has told, is a bit lengthier topic, but I have minimized this topic, which will be mainly suitable for the PG scholars and future researchers. So the basics thing, what they have to learn in the process of writing a research article, and what guidelines they have to follow, and how thesis and dissertation should be there. What is the differences? All these things, a overview I am presenting in front of you. So let's begin the session. So the topic given for me is scientific writing and publication skills. The contents of this topic presentations are: first one is regarding familiarization with publication guidelines, which are general specific and which are internationally accepted, like CONSORT guidelines. Second one is how the IMRAD pattern of the article should be written. That is, any research articles which you are going to publish in Ayurveda or in any integrative medicine or any medical research work, what type of the formats is to be taken care of, or it should be written. That is called IMRAD pattern, where I stands for introduction, M stands for methods, R stands for research and discussion. Third point is different types of referencing and bibliography. And the fourth point is thesis or dissertation, its contents and structures. So I'll be discussing on these 4 points today. The first one is regarding the familiarization of publication guidelines, which are journal specific. So if a PG scholar or a researcher or a faculty is going to publish any articles related to medical journal, he has to go through with the guidelines which is specific to each journal. If suppose he is planning to publish in one journal, suppose in IU journal or suppose in JIM or suppose in some our joint assessment, any journal, each journal will be having its own set of specific guidelines. So authors are requested to click on the tab where they are given that author's instruction or instruction to submission. That tab, if you click, there will be a specific set of guidelines. So each journal has its own specific sets of guidelines which is to be followed, and authors are expected to present their articles in that manner. So before preparing the manuscript itself, if you know which journal you are going to publish, you can read the instruction of those journals. And one more thing is, if you are doing a publication which is already similar to the pattern of article which is already published in that journal, you go through once that articles. That if you are doing a clinical trial article or you are submitting a case study or a review article, what is the parameters and how the articles have been written in already published ones. If you go through, you will be having an idea how this journal is accepting the articles and which type of articles this journal are expecting, and what you have to highlight in your journal, what you have to not highlight, what are the style of referencing. All these things, if you see the previous already published article in that journal, you will be having an idea. Apart from that, you should be having these three important things which you should keep in your mind before writing any research article. One is, would another researcher be able to replicate your experiment? Means if you are, suppose you are doing an experiment, you are submitting a clinical trial or any pharmaceutical or pharmacological study, whether any another researcher who is seeing your article and is able to do a similar type of study by referring your article. So whether that reproducibility is there in your work, that should be taken care of, and whether the numerical results which are present in your article can easily be extracted. That means if you are doing a PhD work or if you are doing some funded work, there is always some background information what they ask us, previous published work or previous work done, what are those and what are the statistical results obtained in those type of works, what was the mean, what was the standard deviation, what was the number needed to treat. So all these things, there are many numerical values which we see in any article. So that should be clearly spelled out, or it should be clearly written in the article, where the future researcher or any policy maker or any government body which is making any decision wants to take reference of your article, they should be able to extract those statistical results in a internationally acceptable form. It's not that everything we will write in percentage, we will write in just numbers and leave. That will not be having any value. So internationally acceptable statistical tools you have to keep, and it should be easy for the other researchers or other any readers, authors, or any future researchers for them to work out. Then the last point is, have you provided enough detail about your intervention so that its usage in the clinical practice can be applicable? This is an important thing for any medical article. You are doing some new treatment, you are doing some new treatment protocols or surgery or some Panchakarma procedures, where those have been leading to a good clinical result, or it is having good uh, broader and good line of treatment in managing some specific disease. When you publish those type of articles, especially case reports, clinical study articles, so those intervention details should be mentioned properly. It's not that I have done, I will not tell everything clearly or truly. Only little bit I will tell. If they want further information, they should call me, or they should send me the patient. It's not like that. If you want to tell something in an article form, you have to express it clearly. If you don't want to tell, don't write. But if you are writing, it should be very clear. So that's what, enough detail, because it should not, your study should not cause harm to others. By following the results or methodology of your study, it should not cause harm to others. That should be kept in mind when you are writing medical articles. So next comes, who is an author? Whether all your guide, your spouse, your friend, everyone is an author. What do you think? Who is an author? जो भी आपको हेल्प करते हैं, जो भी आपको मदद करते हैं, वो सब author है. So how to decide authorship? For this, we have an guidelines given by ICMJE. ICMJE is International Committee for Medical Journal Editors. So they were given 4 criteria to consider who is an author. So what are those 4 criteria? They tell that all those who are designated as authors should meet these 4 criteria, and those who meet these 4 criteria, only those are considered as authors, and rest all with whom you have taken help, whom you indirectly or directly, they should be given their name in acknowledgement. They cannot be given as authorship. Authorship is mainly based upon these 4 criteria. One is substantial contribution to the concept or design of the work, where they also have this analysis and interpretation of the data of this work has been done. They are helping in, or they are a part of drafting the work, that is making an article, revising the article critically, and important intellectual contribution is given by them, and final approval of the version to be published. They are the decision makers, all the people, and they should be having an accountability for all aspects of the work which is done, whether it is the accuracy, integrity of any part of the work which is done or which is investigated. So they will be responsible person. If they are fulfilling all these 4 criteria, then only you should name a person as main author, co-author, or additional authors. If they are not fulfilling all those 4 criteria, it's better that you should not give them authorship. You can just write them their name in acknowledgement. So what are the guidelines? As I was told, there are a few journal specific guidelines and few international guidelines. Journal specific guidelines, I was told that you have to see the instruction page of each and every journal whichever you are planning to publish. But most of the index journal, most of the international journal follows the guidelines given by Equator Network. Equator Network is one of the agencies which gives guidelines for preparing various articles or reporting various articles. Just a minute. So as you can see, at present there are 472 guidelines for reporting an article in journal. 472 this one guidelines. You have to select which guidelines you want to do or which you want to take. These 472 guidelines are divided into this 10 categories. So if you are doing a randomized trial, the guidelines adopted should be of CONSORT. If you are doing some observational study, the guidelines adopted should be of STROBE. If you are doing a systematic review, the guidelines should be Prisma. For publishing only the synopsis or study protocol, it is called as SPIRIT guidelines or Prisma P guidelines. And for diagnostic and prognostic studies, it is STRAD or Tripod guidelines. If you are doing a case report, it is CARE guidelines. If it is for clinical practice guidelines, it is AGRI or RIGHT guidelines. And if you are doing some qualitative research, it is SRQR or COREC guidelines. And for animal and preclinical studies, it is ARRIVE guidelines. And for quality improvement studies, it is SQUARE guidelines. So these are the 10 main categories where 472 guidelines for reporting any article has been given by Equator Network. So for me, what the topic given is regarding CONSORT guidelines. So CONSORT guidelines will cover only randomized trials. So I'll be speaking only on this CONSORT guidelines because CONSORT is also having 27 extensions of its guidelines. If you see 472, how it is divided, in that CONSORT guidelines is having 27 types, depending upon various types of studies. So what does CONSORT stand for? It stands for Consolidated Standards for Reporting Trials. CONSORT, Consolidated Standards of Reporting Trials. So there are around 27 extended guidelines of CONSORT, various forms of studies, clinical studies. Among those 27, I have just highlighted the important guidelines which we commonly use or which we can use in Ayush research works. The first one is CONSORT Non-Inferiority Guidelines. CONSORT Non-Inferiority Guidelines is for all the research works where you are trying to prove your trial drug is equal to what is the standard drug, or which is your trial drug is not inferior to what is the present standard drug. So I think in previous lectures you have learned what is the three types of clinical trials, that is superiority trial, equivalent trial, and inferiority trial. It's also equivalence trial is also called as non-inferiority trial also. So if we are trying to prove that Sudarshana Churna is equally effective to paracetamol in a clinical study, and for that your study is you are already done and you are writing an article on this. So the guidelines which you have to follow is CONSORT Non-Inferiority Guidelines. You are trying to tell that Sudarshana Churna is equivalent to paracetamol in controlling fever. So even though these CONSORT guidelines are for writing research articles, but I would suggest is when you are planning a research work, or when you are if you are in first year, if you are doing synopsis, you just go through these guidelines and plan your synopsis according to these guidelines, because as of such we don't have any separate guidelines for writing synopsis. But if you follow these guidelines and plan your synopsis accordingly, it will be automatically of international standards. So second one is CONSORT Herbal. This is specific for all the randomized controlled trials of herbal interventions. Any herbal drugs you are doing clinical trial which is randomized in nature, for that you have to follow this CONSORT Herbal guidelines for writing any research article. Third one is CONSORT Non-Pharmacological Treatment Interventions, such as if you are doing surgery, if you are doing some rehabilitation physiotherapy work, you are doing some educational research, you are doing some psychotherapy, you are doing some research on some medical devices. So this represents a wide range of interventions where there is no direct medicine administered. It is by a device, process, or a technique what you are doing to, but it is an intervention. You are doing a randomization there. It is a clinical study, but it is non-pharmacological. For writing those type of research works, you have to follow this CONSORT Non-Pharmacological Treatment Interventions. Fourth one is CONSORT Pragmatic Trials. So pragmatic trials are what? It is almost similar to black box design of writing, planning a synopsis with that has been told by WHO, where you are doing a trial in real world condition. That means as and when patient comes to your OPD or your clinic, you are not treating the patient as you are treating as a research participant. You are treating the patient as you routinely do in your OPD or routinely do in your IPD. So that type of research work is called as pragmatic trial. So this CONSORT pragmatic trials has different types of sets of points which should be written in the article. So for that you have to follow this CONSORT pragmatic trials. Similarly for CONSORT CHM formulas for Chinese herbal formulas, and CENT for TCM. CENT for TCM is for N of 1 trials for traditional Chinese medicine. N of 1 trials, I think if you have heard in previous lectures, is N means sample size, 1 means number. So these are clinical trials which are done only with one sample. I think you have heard about this. N of 1 means the sample size is only one upon which the clinical trial has been done and you are reporting that trial. It is usually done in traditional Chinese medicines. I think it's time that even Ayurveda or Ayush works are also being done on this. This type of research work is accepted by the international standards. When you are reporting, you have to follow this send for TCAM guidelines. Similarly, if you are submitting some abstracts to some journal or conferences, so for that also there is a guidelines, that is CONSORT abstracts. That is randomized controlled trials in journal and conference abstract. How you have to write abstracts. Usually abstracts are written in 4 subheadings: introduction or background, aims and objectives, materials and methods, main observation or results, and conclusions. It is called as structured abstracts. So for that you have to follow this CONSORT abstract guidelines. What should be written in introduction? What should be written in materials, methods? What should be written in observations and results? What should be written in conclusion? So that has been explained in this guidelines. Are you all able to understand what I am telling?
Yes, sir. Yes, sir.
So next one is CONSORT PRO. PRO means patient reported or patient oriented outcome in randomized trial. In this type of trials, what the patient is reporting, that is considered to be as an endpoint of the trial, and what the patient is perceiving and what he's telling, that is considered to be the final result. For that type of research, the guidelines to be followed is CONSORT PRO. Then ninth one is CONSORT for within person randomized trials. There are few trials where randomization is not with other person. Randomization is with the same person but with different organ, such as eyes, left eye to right eye, left hand to right hand to left hand, or any other particular. If you are doing some skin disorders or some ulcers, the lesions, ulcers or some venous ulcers in what you call as in legs, what you call that disease, venous, what you call that disease name, I forgot. Those type of studies, varicose, vein. So for
Very good.
that type of study where the randomization is between the different body parts itself, for that you have a guidelines called as CONSORT for within person randomized trials. So how you have to write the article for that type of research is also been mentioned in this. As of now, I think there are no Ayurvedic research works which have done in this format, but Shalakya and Panchakarma people can do, because if you are doing a bilateral or quadriplegic or some other Panchakarma intervention for this paralysis patient, you can compare the sites of the body in which the improvement is seen. So you can randomize, you can plan this type of trial in there. Next, 10th one is CONSORT SPI, that is randomized trial for social and psychological interventions, where you can tell this Yukti Vipashraya, Daiva Vipashraya, all type of chikitsa have been done as a main treatment. This one. For that, you can consider this CONSORT SPI guidelines. And 11th one is CONSORT harms, where better reporting of harm done by any randomized trials or interventions. It should be reported in this format. 12th one is CONSORT cluster, that is cluster randomized trials. The whole sample is divided into a specific structure, a cluster, and how this cluster has been represented in the study and how the results have been evaluated. That it should be represented in this guidelines format. Next, 13th one is CONSORT for multi-arm parallel group randomized trial. This is common type of trial what we do. 2 intervention, 3 interventions we are giving, multiple arm of treatment. Like we are giving in Panchakarma, we are giving Snehana, Svedana, Basti, all those things. So this is called as multi-arm trial. In that, similarly, comparatively, you're using different oil in 2 groups, but the arms of intervention is 3 or 4. So for that type of studies, you can use this CONSORT for multi-arm parallel group randomized trial. Then the last, it is not the last, the CONSORT for pilot and feasibility trial. Pilot studies. Before planning a big study, we are doing a pilot study, which is an what idea giver, or which gives us an idea that how many sample size is to be required, how much the dose is to be given. We don't know the dose of new drug, how it should be done. So all these things are done in pilot study. And feasibility is mainly either cost effectivity or the administration effectivity of drug. For this type of trials, there is a guidelines called as CONSORT for pilot and feasibility trials. So as I told previously, CONSORT is having 27 different guidelines, but among the 27, these 14 are important for us as an Ayush researchers, where we can follow these guidelines and write our research articles in a better form. I'll go one step back. I'll tell that if you are planning any research works, you follow these guidelines and plan your synopsis in this format, so that it will be easy for you to publish the article in any international journal. If you have any doubt in between, you can stop me. So among these 27 CONSORT guidelines, I am taking one guidelines that called as CONSORT Herbal. This is randomized controlled trial for herbal interventions. What are the points it should be taken care of while writing an article? So this CONSORT Herbal guideline, yeah.
What is cluster randomized trial?
If you see randomization, there are many types of randomization. When you select a patient for any enrollment, there is in the randomization, there is cluster randomization, simple randomization. There are many methods, right? You are selecting a population, in that you are selecting a particular subset of an samples, and you are doing intervention in that. In that also, we are giving some specific inclusion criteria, exclusion criteria, including only some that one. That is called clusters. You are making a cluster. If you are taking 100 patients, you are making a cluster of 10 based upon some specific set of guidelines. Or you are doing some intervention only in 10 patients, remaining you are not taking that one. So that is called as clustering. In research methodology, when you learn regarding randomization, I think types of randomization is coming. Cluster randomization, convenient randomization, all those.
And sir, send for TCM guideline, can we use it for in Ayurveda trials also, or it's for Chinese medicine only?
As of now, it is accepted only for Chinese medicine. I think in future days, when our research council accepts, I think we can do. But I don't think we have to wait till the research council accept. If you are writing that research work in this format as sent for TCM, what the CONSORT has been given, if you get permission from the ethical committee of your college, then I think there is no problem. You can do even for Ayush interventions also.
Okay, sir. Thank you, sir.
And nowadays, all the clinical trials has to be registered in CTRI, that is Clinical Trial Registry of India, and it should be done before you enroll the patient. Just right after submission of your synopsis to your college or your university, you have to get your IEC clearance. After getting the IEC clearance, you have to submit for CTRI and get it your registration number of your clinical. Anything else? Okay, we will go to this CONSORT Herbal guidelines. What should be there in an article as per this Herbal research randomized control trial? Shall I proceed forward?
Yes, sir. So there is one question in chat box. There are any specific guidelines for black box design reporting?
Pragmatic trials.
Okay, pragmatic trials. Okay, sir.
Yeah. So coming into this CONSORT Herbal, how the title and abstract should be there. Suppose you are doing a clinical trial on herbal medicine. In the title and abstract section, Either the title or abstract or both should state the herbal medicine or products, its Latin binomial, the part of the plant use, and the type of preparation you are doing, and how the participants were allocated in the intervention. Random allocation or only randomization. You are taking 1,000 patients, in that you are randomly selecting 100. And among that 100, you are randomly allocating 50-50 in two groups, or you are randomly assigning them into different categories. So what type of randomization has been done? What is the herbal medicinal product what you are taking, its botanical name, and which part of the plant is used, and in which form of the like water soluble extract, alcoholic soluble extract, asava, arista, churna, what you are taking, that should be mentioned in title as well in the abstract. Second point is introduction. What you have to write in introduction? Usually we see many times we see irrelevant background information in the introduction section. Actually, what is required in introduction is scientific background of the current work and explanation of the rationale why you are doing this work and how you are doing this work, and the references, either classical references or contemporary references, based upon which you are designed your study. That should come in introduction, not the results, not the materials methods, not the aims, not the objectives, not that. Your background information should consider a brief statement of reasons for the trial with the reference to specific herbal medicinal product which you are using, and if applicable, whether new or traditional indications are being investigated. Means, if suppose Sudarshana Churana you are taking for a new traditional indication for Jwara, or you are taking for something else new, or COVID. Let's say COVID is a new condition. It has not been mentioned in Ayurveda, but you are using the traditional medicine. So you have to specify how you are justifying this using the traditional medicine for a new indication or already specified indication, and what are the current evidences available regarding this, and how you are planning your study. That should be coming in the background information. It should have suitable references. Next important part is the methods. In methods, the third item is participants. That is eligibility criteria for participants and settings, and locations where the data were collected. Means from which place you are enrolling the patient, what is the area you are covering, and if the traditional indication is being tested, a description of how the traditional therapies and concepts were maintained in your present study. For example, participant inclusion criteria should reflect the theories and concepts underlining the traditional indication. If suppose you are taking for Snehana, one patient, how you are telling who are having Yogya Lakshana, who are having Ayogya Lakshana, who are fit for Snehana, who are fit for Virechana, who are fit for Vamana. On what basis you are including the patient in your study? Based upon the traditional concept in what your Ayurveda says, or Unani says, Siddha says. What based upon that, it should be mentioned in the inclusion criteria properly. Next one is intervention. Intervention is having 4A, 4B, 4B, 4C, 4D, 4 parts. So precise details of intervention intended for each group and how and when they were actually administered should be mentioned precisely. You should not mention in a paragraph story. Just mention Sudarshana Churna in group A with this and this Anupana and this dosage form and this at this time specifically. So if you are using a herbal medicinal product, then what should be mentioned in the intervention? As already told, the Latin binomial name, the botanical authority, the family of each herbal ingredient, common name, which should also be included if possible, because many of the readers of our articles are they are common people. We
Yes, sir.
write Any issue?
Sir, please
Yeah.
continue.
So you have to write, if possible, the common name either in your local language or in a uniform language. Then if you are using a proprietary product like the Shamolarista from Dabur, you have to write the brand name, if possible permission from the uh, pharmacy is to be obtained. And if you are using extract from specific or company, you have to, like in this example they are given EGB 761, that is the extract which has been used from some chemical company that they have mentioned. And name of the manufacturer of the product has to be mentioned, and whether the product used is authorized in the country in which the study has been conducted. If suppose you are using Dashmolarista of Dabur Pharmacy, so whether this Dashmolarista of Dabur is permitted in India to be used, that you have to check and confirm with the pharmacy once, and then only you have to put their name in the article. Most of the times what happens, we blindly put the names of proprietary medications. Without your knowledge, the pharmacy company will be using your article for branding their work, their product. जब भी this medical representative comes, he'll show, sorry, this article has used, this research has been conducted on our Dashimolarista, and it has been published in this and this article. So it is globally accepted, and it is having good research, sound research backup. You don't know that your work has been used by them without your permission. Similarly, you have to take permission from them before using their product also. Next, 4B is characteristics of herbal products. That is, the parts of the plant to produce the product or extract which has been used, that should also be mentioned. You are using branches, roots, leaves, flower, fruit, what? And type of the product used, whether raw or extract, that is fresh or dry. The type and concentration of extraction solvent used, that is, you are using water soluble, ethanol soluble, glycerin soluble, and how much percentage of that is used. And the ratio of herbal drug to extract, means you are using 2 parts of herbal drugs to extract 1 part of any extract. That ratio also should be mentioned in this guidelines, as per this guidelines. And the last important thing is what method of authentication of raw materials you have done for preparing the trial drug by yourself or your pharmacy, and you have to keep a specimen of the raw drug in your pharmacy. You have to give a voucher number, and it should be identified from an authenticate pharmacognosist or some botanical lab, where they tell that yes, the product ingredients or raw materials used by the researcher in this combination are all original or without any adulteration or without any what you call as substitute. That should be mentioned. Then 4th C is dosage, regimen, and quality description. Means the dosage of the product, the duration of administration, and how these medicines were administered. Oral route, rectal route, injections, what and all you have to mention. The contents, that is the, if you are using a combination, what is the content of each part or each ingredient in that, how it is added, what is the dose per unit form, and any binders, fillers, or excipient agents are used. If you're making tablet, tea, all those things, any binders, fillers, or excipients, that should be mentioned. And for standardized products, the quantity of active or markant constituent per dosage unit form. If suppose you are telling, if you are giving Triphala, so all the 3 parts are equal. So if you are giving in any other combination, if suppose only Haritaki is the main ingredient, so how much the active marker content in 5 grams of one powder Haritaki is there, that should also be mentioned in that article. This is not followed nowadays. Till now it has not been followed. but it is ideal that if at all you are giving Asava, Arista, Churna, tablet, anything 500 mg, 200 mg, what is the main ingredient of that combination, and in that 500 mg, how much part of this main ingredient is there, that should be mentioned. Fourth D is qualitative testing, that is HPLC, chemical fingerprints, and methods used, and what type of chemical analysis of the samples what you have procured have been done. Even though you are doing a clinical trial, it is ideal that you get, if you are doing the preparation of your own drug in your pharmacy, it is ideally that you have to do a qualitative testing of all the physicochemical analysis, purity testing, and for standardization of all your trial drug, you have to do it in your pharmaceutical lab, research lab. 4E is placebo or control group. Means if you are comparing your trial drug with a placebo or control group, you have to mention why you have taken this placebo or why you have taken this control. What is the rationale behind that? It should be mentioned. And 4F is description of the practitioner who are part of the intervention. Who is doing this trial? What is his educational qualification? Why he is doing this trial? And whether it is for a training purpose or it is a practice experience purpose or it is for a doctorate purpose or a partial fulfillment of purpose, that it should be mentioned in the article. Next one is the objective. Till now it was our all this regarding the intervention. Next one is objective. You have to have a specific objective. Usually there are two objectives, primary objective and secondary objective. Based upon that, we have two outcomes, that is primary outcomes and secondary outcomes. So objective should be what are the main things you have to you are trying to bring out from your study. It should be mentioned in the objectives with the hypothesis corresponding to your objectives. Aims is broad term. Objectives are the methods how you fulfill the aims, and hypothesis is how you justify your study that your null hypothesis, which is always a negation of your intended work, is being nullified, and you are accepting the alternate hypothesis, which is usually your positive outcome of your intended study, which has been accepted. So that has to be mentioned in the objective criteria. Like similarly, outcomes, what I have told, sixth point is it should be clearly defined what is the primary outcome, what is the secondary outcome, and what are the measures you are doing that one, and when this primary outcome is assessed, when the secondary outcomes are assessed, what are the methods you are using for this assessment of this quality of these measurements. So outcome measures should reflect the interventions and indication tested, considering where applicable, and because the outcome is directly related with the theory and concept what you are planning to validate. That's why. Next, seventh point is sample size. How sample size was determined, and when applicable, explanation of any interim analysis and stopping rules. So nowadays what happens, all Ayurveda research works we see in PG level, 30 patients, 15 in one group, 15 in one group, it is finished. In PG, PhD sometimes 100 patients. If the case is more frequently, 200 patients finished. But that is not how the sample size is calculated. If you are doing any clinical trial, your sample size should be calculated based upon the any previous work upon which you are telling that you are basing your study, and you are telling that my intervention is superior than the current available medicine, or it is equivalent to the current available medicine, but it is having, even though it is equal, it is having less cost effectiveness, less side effects, and more easily available. And inferior means you are trying to prove that something already is in the market, you are trying to tell that this is an inferiority, this drug does not have some good benefit, it is having some inferior effect. So that for that you are calculating the sample size based upon the mean and standard deviation of any of your previous studies, and based upon that you are determining the margin difference. Suppose, propose my one PhD scholar is doing a work on malnutrition. So he wants to see the effect of Ayurveda intervention in improving the weight. He is taking a previous study where the mean weight gain after the completion of the study was 2 kgs with the plus or minus standard deviation of 0.5. So he is telling that my intervention is more effective than what the previous studies has been showing. So how you will tell your study is more effective? If any intervention is to be clinically more effective and statistically more effective, it should be having minimum 20% difference, 20% superiority or difference. That is, if suppose the standard drug is giving only 2 kgs improvement in malnourished patients after treatment, your drug should be having more than 2 kgs. That is 20% more than the 2 kgs. That is 2.4 kgs. That if your new drug is bringing out the effect, then it is considered to be better than the standard drug. So that is how the sample size has been calculated, and it should be mentioned. Actually, sample size calculation is one of the bigger topics, but just in a simpler form, I'm just mentioning it to you. The 8th point is random sequence allocation. Means how you used for randomization, like allocation randomization, selection randomization, or any restrictions you have put. Based upon that, you are telling which type of randomized, computer generate randomization, lottery method, random allocation, simple random sampling, first come first basis, or blocking, stratification. What is the method you have followed? You have to mention in the article. Then allocation concealment means whether it is a single blind study, double blind study, triple blind study, what type of allocations you are doing, means method used to implement the random allocation sequence. Even the researcher will not be knowing which patient will be going into which group. That allocation process is also kept in a concealment, and only third person will be knowing which patient is gone to which group and what patient has been given. That if you have done, you have to mention in the allocation concealment area. Then implementation means who generated the allocation sequence, whether a researcher or a third party or your colleague, your guide or your supervisor, who has done. Then who enrolled the patient, whether you are self-enrolled or a nurse enrolled or some other students have helped you in enrollment, and who assigned the participant in the group. All the details has to be mentioned in the article. Like then similarly blinding, then statistical methods, what methods have been used to compare the primary outcomes, and if any additional analysis like subgroup analysis or some adjusted analysis you have done, that also be mentioned. Suppose what is this adjusted analysis is, you are doing a work on HP hemoglobin percentage improvement in anemic patient. Out of 50 patients, 10 patients here having very extreme values. If you see the 95% distribution of the Gaussian curve, in that 95, 99% and 50 like that many 75 like that many endpoints are there, and cut points are there. So if this 50, out of 50, 10 patients are having extreme range, one is having very high improvement, one is having very low improvement, one is having decrease in hemoglobin level after your administration of the drug. At that time, what you will do is you will remove those 10 patients from your main study for statistical analysis. You will do only analysis of those 40 patients, and you will justify that why these patients have been removed from statistical analysis, and you will do a separate analysis of them and give results. That is called as adjusted analysis. Or if suppose treatment duration has been reduced because of some complication, death, or some early improvement, at that time you are stopping the intervention in early period, and that type of adjusted analysis has to be mentioned in statistical methods. Next, coming to the results. Results in that, this is the 13th point or item, that is the participant flow. Means usually you have to, it's also called as CONSORT guidelines. There is a table called as allocation of the randomization of the patients. Then based upon your inclusion and exclusion criteria, if the patient is fulfilling your criteria, inclusion criteria, you are enrolling. If the patient is not fulfilling the exclusion criteria, you are excluding. You are giving how many numbers you are excluded. And here in inclusion criteria, if the patient is fulfilling, you're mentioning how many patients fulfill the criteria. And in this included criteria, what analysis you are given, a flow chart has been mentioned. That is called as CONSORT flow chart, that has to be mentioned in the participant flow. You see, it is not in usually in writing, it's in a flow chart format. Then recruitment, that is dates from when to when you recruited the patient, when you stopped recruiting, when you started assessing. Then when you start recruiting, what are the baseline data or demographic or clinical characteristics of each group, including concomitant medication of allopathic origin, herbal medicine, or some complementary medicine, what and all the I'm telling child because I'm from pediatric. A patient has been used. All these things should be mentioned in the baseline data. Usually we consider it as a history part. Then numbers analyzed. What is the number of participants in each group included for each analysis, and whether the analysis was by the intention to treat. Means whether state the result is absolute numbers when feasible. Means whether all the patients completed your treatment, or if dropped out, how many of the patients were dropped out, what were the number analyzed, and each observations like age, gender, caste, socioeconomic status, it should be mentioned in the percentage form with the number of patients enrolled. Even though they have dropped out, but the observation what you get, it should be of the whole number of patients. Only in the results section, you will be including the patients who have completed both before treatment and after treatment analysis. But for observation, you can include for all the patients, including the dropout. Then outcomes and estimation. For each primary and secondary outcome, a summary of results for each group and estimated effect size and precision at 95% confident interval has to be mentioned. What we usually do is we have some set of subjective criteria and objective criteria. At the end of study, we will tell that this 20% of patients got a statistically significant improvement. But that statistically significant improvement what you are getting or which you are not getting, whether it is justified by the number of samples used for the evaluation in the study. Suppose you are using 30 patients, in that only 10 patients had anemia, and you are telling that in that 10 patient after treatment, all the 10 patients had clinically significant result. Even though statistically you are telling it is correct, it is having a statistically significant result, but whether only assessment in this 10 patients was enough to tell that this drug is effective in anemia, that is called as estimated effect size. Effect size is the effect what you obtain against the sample size, whether that number of sample size is sufficient to tell that your drug is effective in anemia. That is called as estimated effect size. Next one is ancillary analysis, that is the secondary outcomes and any other additional findings or any to address any multiplicity by reporting any other analysis which was originally not part of your synopsis, but as and when you start doing the research work, many things you will come to know. Nobody can prefix whatever guidelines we follow, whatever we follow. After we start originally doing our research work, at that time only we'll come to know many other integral components of research. Means तो मुझे लगता है ये भी include करना था, वो भी include करना था. but I forgot at that time. That those kind of things are called as ancillary findings, and the assessment of that is called as ancillary analysis. So indicating those pre-specified and those exploratory components which are, if you have already pre-specified, these are the additional things we are finding out in the study, then it's okay. If you are not mentioned also, you can add in this section. Then important thing is adverse events. All important adverse events or side effects in each intervention group should be mentioned immediately within 24 hours to your respective IEC committees. And if you have mentioned, if you have got any adverse events, you have to mention in the results section. If you have not got, you mentioned that no adverse event seen. Next, coming to the last part is the discussion. How you have to write the discussion. Most of the time when we see articles, what we see is result is same copy pasted in discussion. That is not the way how you write that discussion. Discussion should be having three parts: interpretation, generalizability, and overall evidence. One is interpretation, is how the results are interpretation of results are being done, taking into account the study hypothesis, sources of potential bias or imprecision in the statistical tool, and the dangers associated with multiplicity of analysis and outcomes. Means you are analyzing a outcome of a study based upon some specific hypothesis, but you are not highlighting the biases or some imperfectness in the statistical tool analysis, or you don't know which parametric test you have to use, which non-parametric test you have to use, whether you have to use a correlation sign, whether you have to use a number specific clinical significance is calculated by some test called as number needed to treat. So which type of statistical test you have used, what was the analysis, what are the, if you are doing multiple analysis at one time, you may be missing the your primary outcome. So all these things, how this interpretation of this results has been done, it should be explained in the discussion section. Then interpretation of the results in the light of product which you are used and the dose regimen used. Suppose you are telling Sudarshana Churna in COVID I am using. This is the first time it has been used at this dosage level, and at this dosage level in this form, in this condition, we have got results in this subjective parameters, this objective parameters. That should be discussed, and it should be clear cut. There will be, it may act, it may will, that if most of the time if possible, it should be not be there. It should be clear cut. Next point is generalizability. Means that is external validity of trial finding. Means is your trial, similar trial, if somebody else has done, you are comparing the trial of your result of your trial and the result of that one, and you are doing a validity of your study. That's called as external validity. Wherever possible, discuss how this herbal product or dosage regimen used relate to what is used in the self-care or practice. Means you have to justify the usage of this traditional herbal drug or dosage regimen which is used. Most of the time traditional healers, folklore practitioners are also using those medication, but they don't have any scientific data to prove. They just go to those vaidyas or practitioners, take medicine and come. But you are justifying the same with a structured scientific parameter. So you are comparing the results of this one with those, and you are giving a generalizability for your evidence. Next is overall evidence, that is general interpretation of the results in the context of current evidence. Means अभी के आपकी स्टडी की फाइंडिंग्स के बेसिस में you are writing a interpretation that this drug is beneficial in this so and so condition, in so and so this one dosage form, and the discussion of the result, a trial result in relation to trials of other available products in similar. ओवरऑल एक वर्डिंग आप डाल देते हैं, इसमें आप मोड ऑफ एक्शन डाल सकते हैं, and in this you can tell what specific component of the trial drug, whether the duration was sufficient or insufficient. All those things you have to mention in the overall evidence of the herbal drug or a dosage regimen. So these are the standard guidelines for reporting a herbal drug which is being used for a randomized clinical trial. So it has 22 items, and these points should be taken care of when you are writing a research article. So this completes our one part of the today's topic, that is familiarization with the journal specific guidelines and CONSORT guidelines. And everyone is getting bored. You're able
No,
to
sir.
understand, or anything I should repeat?
Yes, sir. There are few questions in chat box.
I think we'll take it in last. No?
Okay, sir. Sure, sir.
Okay. Next, coming into the research article structuring, that is introduction, methods, results, and discussions. So how you have to, even though you are following a CONSORT guidelines, though you are using all those things, if you know that one, I think this part is simply an easier part. It is called as IMRAD pattern. Most of the research journals are written in this format, but those CONSORT guideline points are the sub points of this each individual part. Introduction we saw, in background what we have to write, methods we saw what and all, and this is just a repetition, but I'll just add few more points which are not told in the CONSORT guidelines. So introduction, in introduction we have to provide the context or background of the study, that is the nature of the problem and its significance, like in COVID, and its the magnitude of its problem and its significance, and that's why we are doing this clinical trial. That has to be mentioned in the introduction. Whenever you are writing a synopsis or a research article, introduction is the main part, where you tell that by reading that itself, the evaluator or a person sitting in the opposite side should tell that अरे नहीं इसके ऊपर काम होना ही है, बच्चे का इसके ऊपर काम होना ही है. So that impression should be brought about in this introduction section. So state the specific purpose of your research objective or hypothesis which you have to test, and what type of study or observation you are planning. And you cite only direct and relevant references and do not include data or conclusion of the present work. In introduction, don't write how you are doing study or materials, methods, your results and conclusion. Don't put that one. Only what is your background of this problem, how you are going to address this problem, what are the main objectives, and what are the significance. Only that has to be mentioned in the introduction part. We always say Ayurveda is an ancient study, Ayurveda is an Indian medicine. सभी आर्टिकल में वही रहता है पहला सेंटेंस, आयुर्वेदा इज द एज ओल्ड विजडम ऑफ इंडिया, इंपॉर्टेंट कॉन्ट्रीब्यूशन. वो तो सबको पता है, आपको लिखने का क्या जरूरत है. And most of the time when we see any Ayurveda article, when if the disease is already mentioned in Ayurveda, we see that आयुर्वेद ने इसका 5 प्रकार बताया है, इसका संप्राप्ति ऐसा है, इसका वैसा है, इसका वैसा. वो सब टेक्स्ट बुक में ना आप इसमें लिख के नया कंट्रीब्यूशन क्या रहता है. आर्टिकल इज ए न्यू कंट्रीब्यूशन ऑफ नॉलेज. you give an interpretation why उसका only 5 प्रकार है, why उसका संप्राप्ति वैसा ही है. You have to give that type of information in articles, not which is already present in various textbooks. That does not carry any value. It will be one of the junks which nobody will going to read. So you have to be very specific in introduction. Next point is methods. Methods are the core of your study. I told you in the first slide itself, if somebody wants to do a similar type of work by seeing your work, these methods of your study is what they use. So you have to be very clear in what method you are using in this your clinical trial or any article or any study. You have to mention it very clearly. In this section, you should include only information that was available at the time of plan or protocol of the study is being written, And if an organization was paid or otherwise contracted for help to conduct the research, it should be mentioned in the methods. If you are getting fund from some other organization, it should be mentioned in this methods also. Next, methods. Original article should provide ethical clear reference number and CTRI registration details. I have already told this one. Next one, clearly describe the selection of observational or experimental participants. Means whether you are taking healthy individuals or health patients, you are including some controls, what are the eligibility and exclusion criteria, and distribution of source of population. You are taking from New Delhi, you are taking from, in New Delhi, you are taking in one specific Dwaraka, or you are taking some other specific area. You have to mention all those things in this material set, method section, and specify the main and secondary objective. Main objectives is nothing but the primary objective, and the secondary objective of the study, usually identified as primary and secondary outcome. Objective is outcome later. Then what, identify the methods what you are using, what equipments you are using, give the manufacturer's name and address in the parenthesis. This is important because I have already told that if someone else also wants to do similar work, should get information from your reading your article. And procedures in sufficient detail to allow others to reproduce the results. Means you have to mention the exact methodology how you have to do, because you may be working in Panchakarma on one oil, on one disease. The same methodology other person wants to do in different oil in different disease. But the methodology is wanting to use yours. If you give insufficient data, it will not be help for you also, for other also. And if that other person is, if you are a friend, every time he'll call you, sir, आपने इतना ही बताया, बाकी का मैं कहाँ से मिलूंगा? Then every time you will be getting disturbed also, you will be getting many calls. उससे अच्छा उसको दे दो, क्या तुमको देखना है, इसमें देखो, इसमें सब मैंने लिखा है. Then describe new or substantially modified methods if you are using, and gives the reason for using them, why you are using, and evaluate their limitations. If you are using a new methods of some Basti or some other procedure, why you are using that new methods, what are its limitation and what is its strength. Limitation means uska कार्मुकता कम क्यों है, या उसका limitation, I think everyone understand उसका barrier क्या है, what is the strength, what is इसका benefits क्या है, that you should be mentioned. Then identify precisely all drugs and chemicals used, including appropriate scientific names and gene names of herbal drugs, dose, route, and already I have discussed. Then mention the statistical tool used during the analysis of observation and results. And this also I have used. But few journals, they will ask, define statistical terms what you have used, observation, abbreviations, and mostly the symbols, less than, more to. If you are using subjective criteria, most of the times we'll write before treatment, can do plus, after treatment it is minus. Who knows what is plus, what is minus? Only you are knowing, but the reader does not know, reviewer does not know, editor does not know. What is 2 plus, what is 3 plus? Nobody knows. You have to give the description there. And specify the statistical software packages and version used in this study. Next, coming to the results section. Results में क्या लिखना है? All the information obtained during the study belongs to the section of results. Present the results in logical sequence in the text, tables, and figures, providing the main and most important finding the first. Matlab, you are telling range of movement is the most important criteria in your study. You explain first result upon that one. If you tell CBC, ESR, all those things which are the additional this one, the reviewer and the reader will not be having that much insight or time to patience to read all those things. They'll tell that इसमें CBC में कुछ भी result नहीं आया, इसमें study में कुछ ये नहीं. But your important finding is still down there, but he has not seen that completely, or the first thing is not given proper importance. That's what they wanted to be. Do not repeat all data in tables or figures in the text. This is commonly happening. Every time we see table में जो लिखा है उसको ही नीचे उसका explanation लिखते हैं. नहीं तो we have seen that only table is mentioned, there is no explanation. Sometimes only explanation is given, table is not there. It should not happen like that. What data or what flowchart figures what you are mentioning, उसका important gist और उसका important findings को you have to summarize in the result. But just emphasize or summarize only the most important observations in each table, not everything. If 8 females are 10 in A group, 12 in B group, another male is in A group are so much, in B group it's so. वो सब आप टेबल में भी लिखते हैं, वापस उसका एक्सप्लेनेशन उसका परसेंटेज लिखते हैं, वो सब डबल रिपीटिशन होता है, ऐसा नहीं लिखना. That's right. Males were more prominently seen in the study in both the groups. Females were more seen or equal distribution. What is your main finding that you have to just summarize in the each tables below. Provide data on all the primary and secondary outcomes identified in the section of methods. This is important. Most of the times what happens, you have mentioned what is primary outcome, what is secondary outcome. But in results, only primary is there, secondary is not there, only secondary is there, primary is not there. In primary also, if you are having 2-3 points, only one is mentioned, other is not there. It should not happen like that. Whatever you have claimed you will be doing in methods, it should be mentioned in the results section. Next one is discussion. Discussion is a very important part of any article, because this is where the real metal of a researcher is seen. How the research scholar is able to convince the scientific world to justify the results what you have got. It may be positive, it may be negative. How you are going to justify it, or how you are putting forth that your drug is the only choice of medicine for this disease in future usage. All these things will come in discussion. So emphasize the new and important aspects of the study and the conclusion that are drawn from it in the context of totality of best available evidences. Suppose you are using a new or some important aspects you are found in the results. This should be justified with the available evidences. What are the best available evidences regarding this? उसके साथ compare कीजिए, उसके साथ link करके you have to establish your treatment modalities. Again, do not repeat discussion in most of the times we have seen. Even in thesis also we have seen that results is explained in discussion as इसमें इतना ये आया उतना ये आया storage ऐसा, सिर्फ you are writing the results only. You are not giving reason why it has happened. So what are the current available evidences telling about this? There is no discussion. You are just repeating the results. It should not happen. So do not repeat the data or any other information given in other parts of manuscript, such as introduction or research. This is also happening. Sometimes what happens, introduction में जो लिखा है उसको वापस discussion में लिखते हैं. Results में जो लिखा है उसको वापस. It should not happen like that. Discussion is separate. Materials methods is separate. Results is separate. Introduction is separate. Everything is linked, but it is not repetition. Like, for example, experimental studies, how you have to write discussion. It is useful to begin the discussion by briefly summarizing the main findings. You summarize the main findings. In our study, we had found so and so results. Then explore the possible mechanisms. How this studies, how this finding by this trial drug, how this has possible mechanisms. What are the explanation of those findings, and compare and contrast the result with other relevant studies. Mention the limitation of your study and explore the implications of the findings for the future work. आपकी studies का future implication क्या हो सकता है? Whether you want to do it in multicentric trial, you want to do it in some other disease, you want to do it in some other place or larger sample size. You have to explore that one. You have to mention those things. And what are the implication of your findings for clinical practice? If you are doing a Panchakarma for some paralysis and you found that this type of basti is effective in this type of Panchakarma, paralysis. You have to bring it to the clinical practice. Then you have to mention it in a clear way where even a common person reads and understands that yeah, there is a treatment modality in Ayurveda where this type of Panchakarma is used in this type of paralysis. So most of the times these writers, what they confuse is they think that अरे हमको कॉमन पब्लिक को भी बताना है तो हम थोड़ा न्यूज़पेपर में जैसे ऐड जैसे लिखते हैं, मैगजीन में लिखते हैं, वैसे लिखना पड़े. Your article is a scientific article. Common people should be able to read and understand. It doesn't mean that you are giving information in the form of newspaper, magazine. Hence, we advise the readers to do so and so. This is not the way how we write research articles. We will tell that these are our findings. These are the results what you have got, and the results may be because of this one, or is may due to this one. So it can be used in this one condition. That is how you write the discussion. It is not that it should be used, it should be implemented by government of India. No, nothing. In one article, one clinical trial, government of India will not do anything. It should be having concrete evidences. Next, how to write conclusion. So in conclusion, again, don't repeat the results, don't repeat the discussion. Link the conclusion with the goals of the study. Objective, what you have set, primary objective, secondary objective, what are the aims. You link the conclusion of the study with your goals, but avoid unqualified statements and conclusion not supported by your data. Means you will write that, hence this drug will work magically in this condition. Don't write like that. You will write that this drug will be having beautiful effect. There is no scientific term like beautiful. Don't write like that. Whatever your data, your results, what you have obtained, based upon that only conclusion has to be drawn. In particular, distinguish between the clinical and statistical significance. Sometimes what happens, your drug will be having good result clinically, but statistically there will be no significant effect. You have to first clear off all the options of whether improper or imprecise statistical tools, whether I have used because of that. Our study, even though clinically it is beneficial, statistically it is showing insignificance. Vaisa hai kya? You have to clear it off. You have cleared that all the statistical tools used by you is correct, but still clinically patients are feeling effective, but parameters which are used, gradings what you are used may be wrong, and maybe the statistical significance has not been shown. So you have to identify that between the clinical and statistical significance, and avoid making statements on economic benefits and cost unless the manuscript includes any appropriate economic data or analysis. Usually what we see in case reports of Ayurveda or Ayush articles is, hence, or clinical trials maybe we see that, hence we recommend this treatment modality is cost effective as compared to modern medicine. But you have not used any appropriate analysis method or techniques to analyze economic benefits, because cost effectivity study and cost analysis study is a separate part which cannot be clubbed with clinical part. The variables are something different, assessment parameters are something different. So don't make any statements like this. Also, avoid claiming priority or alluding to work that has not been completed. Means you will conclude that hence we claim that the present study, or once we conclude that the present study or present trial track is more superior than that. You are not you are doing a single case study and you are telling your drug is more effective than the other standard drug, and your work is not completed fully. You are not passed all the 4 phases of clinical trial, and you are telling that it is more beneficial. Don't do that. In conclusion, be specific to only what results you have obtained in your study and what justification you can draw from the discussion part, and state new hypotheses when warranted, but label them clearly. When you think that the study has brought about this new findings, you have to mention it that the present study hypothesis the usage of this drug in so and so diseases. If it required, you will mention, but so and so care should be taken before planning a further study. That should be the how concluding statement should be written. So I think that completes our second part. The third part is referencing style and bibliography. I think most of you know what is reference style and bibliography. You should know what is reference, what is bibliography. So reference is a list of sources we have referred and cited. For example, journal articles. And these are mentioned in the reference section according to the sequence of its usage at the end. Whereas bibliography is the list of sources we have referred only for background reading purpose, but we have not cited at any particular place. Like you are reading a thesis, you are reading a synopsis, you are reading a dissertation, you are reading some government reports, you are reading magazine, you are reading newspaper, but it has not been cited anywhere. That is bibliography. But still you are mentioning the details. It is arranged in some alphabetical order at the end. References, you have used those articles, you have used those synopsis, you have used the thesis or dissertation, and you have cited them at either in introduction or either in a review of literature or in materials methods or somewhere else you have cited. So that it should be numbered and cited. So the method of citations are different. You have different types. The basic difference between referencing and bibliography is this one. One is you have referred, you have used them. Another one is you have used but only for background reading purpose, but you have not cited it at any particular place. That is bibliography. Next, coming to citations. So what is a citation? A citation is a way of giving credit to individual whose work is utilized to support our research. It can be used to locate particular source and it is used to even combat plagiarism because आपने दूसरे का स्टडी रेफर किया सेम का सेम छाप दिया इधर बोले मैंने उसको कोट किया है if you are quoting you cannot copy the same result same discussion same conclusion no that is called as plagiarism so you are just giving a credit for a individual whose work you are utilized and you are using in your work in your form not in the original form. Then typically a citation will include the name of the author, the date, location of publication company, journal title, or DOI. Nowadays, all the articles are having digital object identifier mainly to combat this plagiarism only. So this citation is having different styles. Reference is having no style. Citation is having style. And this the citation style dictates the information necessary for a citation and how the information is ordered, as well as punctuation and other formattings are mentioned. Because each and as I told, each and every journal follows different types of referencing pattern. What are these types of citation? One is Vancouver style, which is used in medicine and natural sciences and sometimes in technology related articles. Second one is Harvard style, which uses both in-text citing and references at the end alphabetically, and it is used in the field of social sciences, technology, and natural sciences. APA, that is American Psychological Association, it is used by educational research, psychology, and sciences, basic sciences research. MLA is again Modern Language Association. It is usually used in humanitarian research works. Chicago and Turabian style is generally used in business, history research, and fine arts research. So for us, for a medical research people, Vancouver, Harvard, and APR are the most three commonly used referencing pattern. So we'll see what is Vancouver style. As you can see, the reference is taken from this NLM, that is National Institute of NLM Library, National Institute of Health. From there, I have taken this referencing style. So ICMJ, that is International Committee of Medical Journal Editors, recommends using Vancouver style as a standard pattern for any reference quoting of medical journal. Suppose it is a print article, online article, article with DOI, with indexed in PubMed or Scope or somewhere. You are using a book, dissertation, thesis. The method of writing synopsis, references is different. So if you are using a Vancouver style, as you see, in the first reference, I've written 6 name, and after that I've written et al, then full stop. In Vancouver style, if more than 6 authors are there, we'll write the first 6 authors name, then we'll write et al, put a full stop, then we'll write name of the article, the title of the article, that is regulation of interstitial excitatory amino acid concentration after cortical contusion injury. After the title, we are putting a full stop. Then you are using the short form of the journal, brain research. The name of the journal is brain research. Then we are again putting a full stop. We are using the year 2002 semicolon 935/1/2 in the bracket. That is volume and issue number, then hyphen, then 40-6, that is 40 to 46 page number. This is the method. That is author name, full stop, title, 40-6, journal, full stop, year, volume, so if you are using an online article, you have to mention it, the internet. If you are taking internet, you have to citation date, available URL.
Participants, please mute your mics.
If you are using a journal article which is having DOI number and index in PubMed, after the same above format, at last you will put a full stop, put a DOI number, full stop, then PubMed index ID number, and if it is in PubMed Central also, you will add PubMed Central ID number. Similarly, for book, you are writing the name of authors, full stop, name of the textbook, full stop, edition, full stop, place of publication, semicolon, who is the publisher, again hyphen, then year of publication. If you are using the page number, again, you can put a semicolon and use the page number. Similarly, for dissertation and thesis, name of the researcher, title of his thesis or dissertation, place of the university. If you are seeing this, Mount Pleasant is the main place of this university, and Central Michigan University is the name of the university, and year of thesis submission. This is how it is done for Vancouver style. Next, coming to Harvard style. In Harvard style, what we'll do, in Vancouver and all, we'll just write after any sentence at particular place, we'll write 1, 2, 3 reference number, and correspondingly at the end of the article, we'll write 1 is this one, 2 is this one, 3 is this one. Whereas in Harvard, what we'll do, we'll not do write reference number. Instead, we'll just write the name of the author. If more than one, you will write et al. Then in bracket, we'll write year, and if page number specifics there, we'll write page number. So we'll just write JUL et al. 2017 PP. PP is from 1 to 8 you are using, then you have to write PP. If you are using only one page, then you have to write only single P. If you are using a page range, then you have to write PP. Then you will close the bracket. This you will use in between the articles also, wherever your reference you are citing, in between the article also you are using them. And at last, you are writing this full references in alphabetical manner. Did you understand? In Vancouver, we'll just write the numbers, reference number 1, 2, 3, and correspondingly we'll cite. Whereas in Harvard style, we will not write number, we'll write the name of the researcher and year, and it is not number, and in last it is arranged in an alphabetical manner. And in a Harvard style, there is no full stop in between. name of the authors, comma, title, comma, name of the journal in italics with capitals, comma, volume, comma, issue number, page number, DOI, all those things. There is no full stop in between Harvard style. Only in Vancouver style, after each segment, we have full stop. I think this is clear with this. You can go through this online link where I have given. There's a PDF on this you can download. Similarly, for book, name of the author, year, gender is the name of his book. Qualitative Press is the name of his press, and Cambridge is the place. So in Vancouver, first name of the this one, year will come at last, whereas in Harvard style name will come first, and in Harvard the name of the press will come first, then the place will come. Whereas in Vancouver, name of the press will come at last, but the place of publication will come at first. That is the main difference between Harvard and Vancouver. Next, coming to APA. APA reference is a variant of Harvard style only. It is almost similar to Harvard, but it is usually to include a reference list rather than bibliography. Means citation for websites are slightly different with no need of including which date of citation you did, or which date of access you did, which type of date of retrieval, unless you think that the website is constantly changing over the time, then only you have to write the date of retrieval or date of. If you think that website is not going to change, I think APA and Harvard are almost same. Next important doubt many will be having: how to write Ayurvedic classic citations. So I have taken this reference from Ayu Journal. So there are mainly different categories how to write Ayurvedic classics references. Usually, name of the original author is written, then name of the Samhita is written, then the editor, name of the Sthana, then serial number of chapter, then shloka number, edition of the book, name of the publisher, year of publication, and at last page number if required. Otherwise, you can skip. So if suppose you are using Charaka Samhita, Agnivesha is the main author. Charaka Samhita of Acharya Charaka, Dridhabalakrit, edited by Vaidya Jadavji Trikamji Acharya, full stop, Chikitsa Sthana, full stop, chapter 15, verse 20, second edition, Varanasi hyphen Chaukamba Sanskrit Samsthan, semicolon, year and full stop and page number. This is how a classical Ayurvedic reference is written in any journal. But if suppose you are using a edited version or the view of editor, आपने श्लोका नहीं पढ़ा, श्लोका के नीचे जो explanation लिखा है उसके ऊपर you are
आगे WhatsApp पे ठीक है
as the
okay 25 लाख का प्लॉट लिया.
Then you have to write, okay, instead of the main author, you have to write Jadavji Trikamji. Then you have to give his designation, that is editor, Charaka Samhita of Agnivesha, Chikitsa Sthana, then all the same, chapter number, verse number, edition, Varanasi, place, and similar. Suppose if you are using commentary of Charaka Samhita, then you will write Chakrapani Datta, commentator, Charaka Samhita of Agnivesha, Chikitsa Sthana, then similar, all the other. So this is the three different methods: original Samhita, editor concepts or version you are using, then you have to write the editor first. If you are using commentary, then name of the commentator, then all those things are different. Then coming to the last part of our presentation, I think I am over time now. Thesis and dissertation content and its structures. So what is thesis? Thesis is a project that is submitted during the completion of doctorate, usually work के लिए और PhD work के लिए, master's program के लिए we tell it as UK and US. We follow UK rule. In US, they'll tell thesis is a shorter form and dissertation is a longer form. But UK tells that thesis is a bigger form, which is having more than 1 lakh words, whereas dissertation is done during masters. It's a compilation of research that provides that we are just thinking that the student is having in-depth knowledge about the subject, and it is for the partial fulfillment of his degree, that is dissertation, and it should be usually less than 80,000 words. That's why in the same, it is ulta in UK and US, it is used in ulta. Thesis is an opportunity where a student is given to contribute a new finding, theory, or practice in the field of his research to the society or to the scientific stream. Where a dissertation does not give any new finding or new theory. We are assessing how the knowledge of research or how capable the scholar is able to do research in his future endeavor. That is just dissertation. Next, how should be the standard structure? I think everyone is knowing a thesis, or this one should be having cover and spine. Cover is the first page, spine is the side area. Title page should be there, signature approval page. Then afterwards, it's a declaration page by both guide and the scholar. Then copyright page to whom you are giving copyright. Usually, thesis copyright will be the university. You have to mention that one. Acknowledgements, to whom and all you have to acknowledge. Table of contents, what are the contents of your thesis or dissertation. List of tables with page number, list of figures with page number, list of symbols, abbreviation, nomenclature, and transliteration with page number. Next comes abstract. Abstract is just a short of your main thesis work. 12th point is the text of the thesis main body, which contains introduction, review of literature, methodology, findings, discussion, summary, conclusion, and implication. These are the main body of your thesis. Then comes the supplementaries or appendixes. Then at last it is the citation of sources, references, and bibliography. This is the standard structure of any thesis or dissertation. But according to your university, you have to follow the guidelines. I'll just tell what should be there, the guidelines. For dissertation, abstract should not be more than 350 words or 2,450 characters fixed. And it should approximately be 1 to 1.5 page in double space. And the abstract should state the research problem in brief, methods and procedure used in gathering the data and analyzing the problem, and provide a concise summary of the findings of your study. That should be it in 350 words. Similarly, for your article also you have to do. Next, all text must be double spaced and it should be justified. Like you're seeing my presentation, all the lines are justified. Ek zyada, ek kam, aisa nahi. Everything is justified, double spaced. Each paragraph should be indented. Indented means this, like if you see the first point for the dissertation. So it is not indented. If you go in and click on the for button and press the tab, the words will go to the right side. That's indent. That should be given. The double spacing is even throughout, and there should not be any quadruple space. कभी कभी क्या हो जाता है, double space देते समय कुछ जगह tables में it will become quadruple space. That should not happen. Next, font set should be 12. However, for tables you can keep 10 font size. Italic print should be used for foreign words or languages like Sanskrit terminologies, and preferably diacritical marks should be used for Sanskrit terminology. Whenever you are writing article, you have to always keep in mind that Sanskrit terminology should be in italics. First letter will be in capital, and in bracket you will be giving English translation when you are using the Sanskrit word for the first time. अब article में आप उन्माद करके लिख रहे हैं, so first time you will write the English translation only. Afterwards you will either write unmada or you will write insanity. You will not write both the things till the end. Only in first time you will write. And unmada throughout your article or your thesis should be U capital and unmada in italics. And diacritical marks, if you can, you have to use. And same type of font should be used throughout the manuscript. Page number, footnotes, and endnotes should be given. and the entire text of the thesis, including headings and page number, must be printed using Times New Roman font. This is the internationally accepted font. For binding purpose, always left side margin should be always 4 centimeter, because you know, when you open the book, if you type more inside and giving more or less gap, you cannot see few words. It will be entering into the binding column. So always 1.5 inches should be there ideally. But if you can't keep that much, at least 1 inch should be given. All information, including page number, etc., should be in the text area in the down. Next, all page numbers should be printed in 1 centimeter above the bottom margin and placed on the right hand side only. ऊपर नहीं आता है पेज नंबर, सिर्फ नीचे ही आता है, बॉटम से 1 सेंटीमीटर ऊपर में रहता है, without any punctuation mark. You can use Roman numerals, and in the preface section, like list of tables, acknowledgement लिखा. फर्स्ट पेज को कोई टाइटल पेज को नंबर नहीं रहता. After all your certificates, everything that will it will be in Roman numerals. The numbering usually begins from second page with Arabic numerals and are used in the pages of the text and supplementary section that आपको same printing करना है. So I think this is end of my presentation. I think I overcooked it. If you are having doubts, I think you can ask. This is my email address and phone number. You can call whenever you want anything.
All the participants, if you have any query or doubt, please unmute yourself and ask.
Sir, can you please elaborate a little about Prisma Guidelines?
Sorry?
Sir, can you please elaborate a bit about Prisma Guidelines?
Okay. So Prisma Guidelines is mainly for systematic review. Systematic reviews are not simple review articles what we write for our Ayurvedic concepts. When you go to this Prisma, mainly it is regarding the methodology what you have adopted for screening the literatures for conducting your review. You may be doing review on some clinical interventions, or you may be doing some review based upon some concepts also. So what type of data is you are collecting? Whether you are collecting clinical trials with so and so parameters, if they are there, only those type of data you are collecting, from which source you are collecting, how you are analyzed, what are the limitations of this analysis, and what are the strengths of this analysis. Usually systematic review and meta-analysis are done for giving a final answer. Clinical randomized, even though randomized trials are gold standard of publication, more than randomized trial, systematic reviews and meta-analysis are considered to be the peak of the evidence generation. If you see the triangle of evidences to be considered, randomized trials are considered as a gold standards, but above them, systematic review and meta-analysis are considered to be the super.
So for meta-analysis also Prisma Guidelines are followed?
Am I audible?
Yes, sir.
Yes. So Prisma is a guideline which is to be used for the systematic reviews, where you are using different other studies. You are collecting the data from other studies, the concept from many samhitas or something, and you are doing a research on that. For that, this Prisma Guidelines is used.
So for meta-analysis also we have to follow the Prisma Guidelines?
You can follow, but meta-analysis has its own guidelines.
Separate guidelines are there for meta-analysis?
Yeah, you can see in the Cochrane library.
Okay. Okay, sir.
Hello, sir. I wanted to ask about the reporting of a literary study. So, are there any guidelines there?
As such, now there is no guidelines for literary review, But what I recommend is you can follow this Prisma guidelines only for systematic review, because the
Okay,
guidelines
sir.
tells that how you have collected the information, what you have analyzed, what you have left out, how you have interpreted it, how we have discussed the concepts with various stakeholders, what are the validation tools we have used. Everything comes under this. So I think Prisma guidelines can be used.
Okay. Thank you,
Uh,
sir.
Sir, regarding systematic reviews, is there like we have to do systematic review only on the clinical trials, or we have to systematic review only on the review articles, or we can do it on the both together collectively? We can do a systematic
Usually,
review incorporating all the review and clinical articles. Is it like that?
Usually, the systematic reviews are based upon the already published data.
Yes, sir.
So, if you are doing on clinical trial only indexed publications which are published in good journals, which are having sufficient numbers of sample size, and which are fulfilling your inclusion criteria, only on that, if you do it is okay. But if you are doing on some concepts, you have to, like what I already told, you have to have a validation tool for analyzing the concepts, and you have to create a validation methodology for this concept from various samhitas or various research publications. If suppose concept of avarana, you are doing a review on concept of avarana. One will tell one thing, another person will tell another thing. But what is your role and how you are validating which one is correct and which one is wrong? So for that, you have to develop a methodology and you have to analyze the concepts of already published data, and then you have to discuss with your peers or with supporting evidences, then bring about the systematic review.
So can
Systematic
we
review is not
incorporate?
an easy process. It is a long term, a long time consuming and an in-depth process, because these are the final words. इसके आगे और कुछ नहीं रहता. उन्होंने बोल दिया पैरासीटामोल या और कुछ ये इसमें इतना ही काम करेगा, इतना ही काम करेगा, उसके ज्यादा वो उसमें ज्यादा नहीं करेगा. But if you are not taking a standard articles for this type of research work, you are taking some poor articles with poor research methodology followed, I think that will not be having any good meaning.
So
That's
can
why
we
you have
incorporate?
to follow the blueprint library guidelines.
Okay. So can we incorporate both review articles and clinical trials in a single systematic review on a disease? Suppose we are taking diabetes mellitus or madhumeh, and we incorporate both review articles and clinical trial articles in a single systematic review, or we have to do it separately
Ideally, it
for.
should not be done. Ideally, it should not be done, because diabetes, what you are in systematic review, what you are planning to do. You are planning to tell the efficacy of some method, treatment methodology, or you are trying to prove the pathophysiology, or you are trying to prove that diabetes is equal to prameha. What you are planning to do. Until and unless your objective is set, you cannot do multiple things in one go. You know.
Okay, sir.
So there is a question in our chat box that from Dr. Sahil Garg, that while writing an article, referencing can be done.
Sorry.
While writing an article, referencing can be done.
While writing an article,
Referencing can be done in discussion section.
discussion, I did not understand. Discussion में reference रहता ही है ना.
And he said, or we write whole discussion section by our own interpretations.
No.
No. Okay, sir.
No. You cannot write discussion on your own interpretation. You can interpret your results in your own words, but it should be justified with some collateral evidences. You will tell that Amuvat में मुझे yeah, what you tell that in Amuvata by Patrapinda Sweda I have got efficacy. But until and you tell at what level you have got efficacy and how you have got efficacy, if you don't explain, who will buy?
Okay, sir.
If you want to write in your own words, then there is no need to write article. We can directly
Yes.
tell that आयुर्वेद में ऑलरेडी सब बता चुके हैं कि पत्रपिंड स्वेद काम करता है
जी सर.
या काम नहीं करता है करके. So if you are writing an article, you should justify that with the evidences that कि तेल को इतना गर्म करके हम करने के बाद वो कैसा काम करता है, स्वेदन
Yes,
कैसा
sir.
काम करता है, स्वेद उसका एविडेंसेस आयुर्वेद में क्या बताया है, what is the properties of the trial drugs used, all that you will आपको references के automatically मिल जाता है. If you are not getting references means then you are not searching.
Yes, sir. Yes.
आयुर्वेद में सभी के लिए रेफरेंस है, कुछ ऐसा नहीं है कि किसी को रेफरेंस नहीं है.
So there is one more question from Dr. Seema, that can you give demo of reference writing style for research article?
Yeah, I've already given. No? We're
Okay,
not
sir.
which style you want, Vancouver style you want, or Harvard style you want, or for Ayurvedic classics you want. You've already given.
Yes, sir. She has not mentioned any style, but Dr.
Ayurvedic
Seema, sir,
classics, sir.
yeah,
Ayurvedic
yeah,
classics, sir, please.
Yeah,
Again,
yeah.
can you tell?
Just a minute, madam. I'll just show you. You want Ayurvedic classics?
Yes, yes.
See, there are three methods I've already told. If you are quoting the original Samhita, if you are quoting the explanation of sloka written by some third editor, third person, or if you are quoting a commentary. This is how you write the reference. If you are taking Charaka Samhita, see, Agnivesha is the main author of Charaka Samhita. Charaka Samhita of Acharya Charaka Dridabalakrita, edited by Vaidya Yadavji Trikamji Acharya. Chikitsasthana, chapter number. If possible, some journals will accept chapter name also. Like because in Kashyapa Samhita we have incomplete Samhita, so at their place we don't know which is first chapter, second chapter. So there we'll write chapter number, not the name. Here in Charaka, Sushruta and Bhagavata we know exact chapter number. We can just write that chapter number, version number, edition, name of place of publication, name of publisher, and place, page number. And if you are using the explanation given below the shloka of any editor of a Samhita, then you will write name of the editor. Jadavji Trikamji editor, Charaka Samhita Agnivesha of Charaka Samhita of Agnivesha, Chikitsasthana. Then remaining else is same. And if you are using Chakrapani commentary, then you will write Chakrapani Datta commentator, Charaka Samhita of Agnivesha, Chikitsasthana, like this. I hope it is clear. Yeah.
Sir, hello.
Yeah.
Sir, about how after how many authors we should write at all? I think what I believe in Vancouver style we write at all after 6 authors, and
Yes.
in AP style we write at all after 3 authors, and in Harvard style we write at all after 1 author. Am I right, sir?
Yes, but you are telling regarding the what you call Harvard style at all is written. If you are seeing the first article, journal article print, JUL et al. 2017 PP 1:8 in bracket. So in Harvard, we are writing this in the article main body. जैसे in Vancouver we'll write one reference site, reference number 1, 2, 3. In Harvard we'll write just name of the first author, then we'll write et al, then year of publication. But
Yes, sir.
at the end of the article, there after 3 or 4 this one name we will put et al. I think it's usually 3 in Harvard, whereas in
In
Vancouver it is
Harvard.
In Harvard, it is 3.
Okay. And so in Vancouver, 6.
Vancouver, 6.
And in APA also it's 3.
It is similar to Harvard.
Okay, sir. Thank you, sir.
I think QA round is over. And now I would like to thank our speaker, Dr. Srihari Seshagiri sir, for enlightening us with their knowledge.
Ma'am, may I ask some more questions?
Yes, you can continue.
Sir, in regard of contents of the dissertation, what is the difference between abstract and introduction? Abstract was a separate point and introduction was a separate point.
Abstract is whole of your thesis you are writing in 1.5 page, including
Okay,
your methodology, results, discussion, conclusion, everything you are writing in 350 words in 1.5 page. That is abstract. Introduction
Okay,
is
sir.
what is the need of your study, what is the background, what is the significance of your study. That is introduction.
Okay, sir. And sir, what is the difference between aims and objectives? While writing synopsis, difference between aims and objectives.
So your aim of the study, I'll just give an example. Your aim of the study is to evaluate the efficacy of Patrapinda Sweda in Sandhivata. Your aim is
Okay, sir.
to evaluate the efficacy of Patrapinda Sweda on Sandhivata. So how
Yes,
you
sir.
will fulfill this aim? The method of fulfilling this aim is through the objectives, what you set. You are telling that
Yes, sir.
pain, range of motion, or sparsha sahisnuta, or crackling sounds, whatever you are telling is the main complaint in Sandhivata. So you will tell that the first objective is to evaluate the efficacy of Patrapinda Sweda on pain in patients suffering with Sandhivata. Second point will be evaluating the efficacy of Patrapinda Sweda on range of motion in patients suffering from Sandhivata. So for this pain and range of motion, you are having some special assessment criteria. So you have to take only those objectives for which you have special assessment criteria. Those becomes your objectives. And through these objectives, you will tell that your Patrapinda Sweda is effective in Sandhivata.
Okay, sir. Thank you, sir. Yes, sir.
Aim
Thank
is
you,
a
sir.
broad
Very nice
term.
presentation.
एम इज ए
Yes, sir.
ब्रॉड टर्म, ऑब्जेक्टिव इसको आप सिंप्लीफाई करके अगर ये ऑब्जेक्टिव्स हमारा फुलफिल हो गया, आप जैसे आपको एमडी डिग्री मिल रहा है, डिग्री
Yes, sir.
सर्टिफिकेट इज योर एम बट योर मार्कशीट
Yes,
इज
sir.
ऑब्जेक्टिव.
Yes, sir.
आपने रिसर्च मेथोडोलॉजी पास किया, 4 पेपर पास किया, फर्स्ट ईयर में 1 पेपर पास किया, ये सब फुलफिल करने के बाद आपको एमडी डिग्री का सर्टिफिकेट मिला, है ना. MD
Yes,
degree
sir.
certificate is your aim, but objective is through passing of all these years, all
Yes,
these
sir.
papers.
Okay, sir. Thank you, sir.
I hope, I think I've taken more time, but I felt that these were the issues, most of the articles what we see now, these are the common mistakes, or I think they may not be oriented, people are not oriented, or they don't know. So that's why I made it in brief, how much I can tell, maximum information in brief I have done. If you are not able to understand, I'm sorry for that. You can contact me, but I've tried to give what little information I can give for you. Yeah.
No, sir, it was very good. You have explained a broad section of research in a very short time. And this session is really, really very, very important for PG scholars, undoubtedly. And I think there are no more queries. Okay. I would like to thank our speaker, Dr. Srihari Seshagiri, sir, for enlightening us with their knowledge about scientific writing and publication skills that contains familiarization with publication guidelines, journal specific and CONSORT guidelines. different types of referencing and bibliography, thesis, dissertation, contents, their contents and research structure, research article structuring, introduction, method, result, and discussion. Lastly, on behalf of Panchakarma department, I would like to express my gratitude to all the participants for patiently listening to this webinar. This event would have been impossible without the support of each and everyone present here. Thank you. Tomorrow the session will be started on the same time from 2 to 3:30 p.m. Thank you, sir. Thank you.
Just one last
Yes.
one point I would like to add.
Yes, sir.
Our university is publishing in a journal called as Journal of Indian System of Medicine. It is published through Medno, Walter Clover's Medno. Like our
Okay.
IU, all these things are published, the same publisher are publishing. So it is free
Oh.
of cost. It is both print and online is there. So if any
Okay,
of you are interested in publishing your articles, you can kindly submit your articles to that. If you are having any doubt, my number is, I already put it in last. You can contact me.
Yes.
Like that. So basically, who are the participants? Actually, I did not know who are the participants.
The participants all are the PG scholars, PhD, and faculty members.
Okay. You can just
Yes.
pass on this information of this journal.
Yes, sure, sir. Sure, sir. We will pass on
If you are having
this.
issues in submission or anything, you can directly contact me so that I can help.
Thank you, sir. Thank you, sir. Thank you, sir.
This is my number. You can contact.